everybody, my name's Kate Still and I'm from the Information and Support team here at the Brain Tumour Charity. Joining me today we have the wonderful Matthew Jones from Carers UK, who is the Helpline and Advice Manager. We've got a number of questions from our community in regards to caring and being a carer in the current crisis. So we just wanted to go through a few of these with you, Matt, today. So firstly, thank you very much for being here.
Thank you very much for having me, Kate. We know at Carers UK this is a really worrying time for carers, so really pleased to help out and answer some questions for your community.
Brilliant, thank you. So first question that we have is, generally, what advice would you give to carers during this pandemic?
So it's a really good question to start with, and we know that caring takes a lot of different forms and caring won't look the same for everybody. So I guess what I'd say first off is that the suggestions and the advice I've talked about today are more general. So if something I'm saying doesn't sound right for your situation, then please do get in touch with us over at Carers UK, send us an email, or with you guys at the Brain Tumour Charity, and we can talk to you more specifically about your situation. I think the most important thing at the moment is to stay up to speed with the government guidance and advice. And that gets updated online at gov.uk/coronavirus. And it is worth having a look on there. There are some specific pages and pieces of guidance for unpaid or informal or family carers, which might be quite helpful to look through at the moment. The other thing that we're talking to carers about a lot at the moment is the importance of having a plan in place, a contingency plan or an emergency plan. And this might be something that you've looked into before. It might be the first time you're thinking about this because of the current situation. But it's a good idea to talk with the person that you care for and put together a plan that looks at things like who you might want to be contacted in an emergency if you weren't able to care for that person for any reason. And other important information, so medication that the person you're caring for is taking, the dosages, where it's kept, any contact details of medical professionals. So thinking, for example, someone with a brain tumour, they may have details of a clinical nurse specialist or a key worker, so details for them. Any care support services that that person receives, and any care products that they make use of and that they may need to reorder, who supplies them. And it can also be a good opportunity to have a conversation with the person you look after, if possible, about how they would like to be looked after and cared for if you weren't able to care for them as you would do normally. So that may just be preferences of the way things are done, or things that for that person it's really important for someone standing in to know about, just so it's all documented in one place and can be shared easily.
Absolutely. That's, really brilliant advice. Thank you so much. So in terms of our community, you mentioned them briefly then, a number of our community are to be considered as vulnerable people in this situation, and so are being required to shield for a number of weeks. This obviously is really difficult for a lot of them, but also for their carers. So do you have any advice that you would give to carers who are having to shield with their loved ones? And are there any extra services to help them access food or medication?
Yeah, so I think firstly, if your partner, the person you care for, has been put into the shielding category, it's more than likely you've been sent a letter about this from the NHS, or you've been given some specific advice by a healthcare worker. It might have been a clinical nurse specialist, like we mentioned earlier. So in the first instance, make sure that you've got that information to hand and that you're following it carefully. If you haven't been sent a shielding letter, because some people are concerned that they should be shielding but they haven't had the information about it, then do speak to your GP, healthcare worker about your concerns, and they should be able to give you some more specific advice. So at the time of us recording this conversation, the government guidance that you're likely to have been given says that if you live with someone who is shielding, you don't necessarily have to shield yourself, but you should be following the social distancing rules carefully and helping that person to shield as much as possible. Mm-hmm. Of course, it might be the case that a healthcare professional has given you some specific advice, so that should always be followed. But if you are living with someone who is shielding, the general advice is to make sure you're washing your hands whenever you enter the home and frequently throughout the day. Also minimizing use of shared spaces as much as possible, sleeping in a different bed if that's possible as well. And if you do have to make use of a shared space, trying to not do this at the same time and cleaning down any spaces, surfaces after they've been used each time, and not sharing things like utensils, towels, trying to separate as much as possible. So if you have been sent a shielding letter, there's more than likely going to be some information on there about how you can register with the government's Extremely Vulnerable Service. So do take a look at that. That's a way of getting help with accessing deliveries of food and medication. Now, thinking about medication specifically, you can speak to your community pharmacist about this, see if they have any delivery services locally that might be able to help so you don't have to go out. If your GP or your healthcare worker uses online services as well, then you may be able to order any repeat prescriptions through this channel too. It's worth keeping in mind that there is likely to be some additional demand on services at the moment. So certainly with repeat prescriptions, if it's possible to order those 7 days in advance, that is quite a helpful thing to do. And the government's Extremely Vulnerable Service can help with medication being delivered too. With food, again, if the person you care for is registered for the Extremely Vulnerable Service, you can use that service to ask for deliveries of food. And we know that supermarkets as well are making use of that register of extremely vulnerable people to help allocate online delivery slots. So again, looking at the service there is a helpful thing to do. We do know that some people are concerned that the person they care for maybe doesn't fall into the extremely vulnerable group that you need to be in to be able to register for that service. But there are also community groups that you can approach who can help with deliveries of supplies as well. So going on to Google and searching for COVID-19 Mutual Aid UK, which is a bit of a mouthful, so I'll say this again, it's COVID-19 Mutual Aid UK. On there you can search for local community groups and they may be able to help you more as well. The other thing we know is that some councils are coordinating local volunteer responses too. So it might be worth going on the website of your local council or speaking to your local council to see if that's something that's working in your area and how they might be able to help as well.
Brilliant, thank you for that information. So that's involving people that are currently living with the person that they're caring for, but we know that a number of people within our community don't currently live with the person they're caring for, but still need to provide this care on a daily basis. What advice would you give to people in this situation?
Yeah, so it's a good question, and a lot of people have contacted us because they're worried about what the government guidance says that you can do when it comes to social distancing and the rules. And the current government guidance surrounding social distancing says that one of the limited reasons you can go out is for any medical need or to provide care or help for someone vulnerable. So if you need to go out for that reason, that is okay under the guidance. If you are doing this, it's also a good idea to be aware of the government guidance that applies to the person that you're going to see, the person you're caring for. So say if they're in the shielding group, taking a look at the shielding guidance, because there are sections on there, as I was mentioning earlier, specifically for unpaid carers and formal carers. So taking a look at that. In terms of kind of good hygiene practices, the guidance talks a lot about the importance of washing your hands as soon as you arrive and frequently throughout your visit. Something that we've been asked about as well is the need to carry any ID or proof, and people concerned that they may be approached by the police if they're going out to care for somebody. Now, to the best of our knowledge, the government guidance doesn't specify the need to carry any form of proof of caring responsibility if you're going out to provide care. So if you are approached by a police officer in this situation, then you could explain to them that you have responsibilities towards someone vulnerable, and that's the reason that you're travelling out of your home at the moment. We know that people would still feel comfortable having something to carry. Unfortunately, there isn't a national register of carers per se, so there isn't a standard carers card or carers ID that can be issued. But if this is something you're looking for, some form of documentation that relates to your caring role, there are a few options you could look into. So the first might be contacting your local carers centre or local carers organisation. Some do operate a carers card scheme, so it's worth checking in with them. We don't actually run those centres at Carers UK, but on our website we do have a directory of these. So if you go to carersuk.org, you'll be able to navigate through stuff and see which centres operate in your area. The other documentation that relates to your caring role might be a shielding letter or a letter from your GP or local authority about your caring role, maybe a carer's assessment if you have one, and some documentation that refers to that. Or if you're in receipt of carer's allowance or have an underlying entitlement to carer's allowance, you might have a letter you can show that relates to that as well.
Brilliant, thank you. Yeah, all really good advice there, thank you. And if in a situation that someone was caring for someone, visiting them daily or living with them, if that carer was to start experiencing coronavirus symptoms, what steps should they take to provide care for their loved one?
Yeah, so if a carer is experiencing symptoms of COVID-19, it is really, really important that they follow the guidance around self-isolation and avoid any face-to-face contact with the person they care for. And we understand that is going to be a really worrying and really difficult decision for someone to have to come to. And in this situation, this is the moment to look to that emergency plan that I was speaking about earlier on. So in the first instance, and if this is an option and if it's appropriate, you could speak to a family member or a trusted friend to see how they may be able to support with the care arrangements of the person you look after at the moment. But if this isn't an appropriate option for you, or it wouldn't be right in your situation, the next would be to contact the social services department at your local council and to let them know that you are a carer, you're having to self-isolate because you've got coronavirus symptoms. And because of this, this means that you're not able to care for somebody who relies on your help. And they should be able to talk to you about what support and what help they can put into place to support you and the person you care for at the moment.